those who are joining us, we are with Madison Oak, who is a vestibular rehab therapist, and she does vestibular rehab therapy virtually. So as you know, Neurahealth is a virtual neurology clinic, and we now are partnering with Madison so that neuro patients can access vestibular rehab therapy at a special price. So we are so excited about that. And then also Madison's patients get access to Neura membership at a special price as well. So we are really, really excited about this partnership.
I'm really excited
to get this
too.
started.
I'm super excited that we got this worked out. And yeah, I'm so excited for all the access that it brings to people with you guys on telehealth and with me on telehealth. I just find it such a good, excellent way to bring people good quality care in places that don't always have it. So
exactly. I wish that all of this were around when I first was diagnosed with vestibular migraine, because
yeah,
I couldn't get anywhere. And it was really difficult for me to navigate the world, especially New York, while dealing with the level of vertigo that I was dealing with. And to be able to have a vestibular rehab therapist who I could see over my computer, especially like in the early days, would have been so
totally. And I
helpful.
also feel like for a lot of people who, when they go see their vestibular therapist, whether it is telehealth or it's in person, that it can be a difficult thing to explain vestibular migraine, because I went to school at University of Wisconsin and we happen to have like a pretty thorough vestibular program overall, but it's still like this much of what you need to know when it comes to vestibular disorders. And I think we had one slide on vestibular migraine, and that's probably like migraine in general also. I think we probably had one slide. And so it's just not something that people get in school. And so it's really, really important to have access to a vestibular therapist, but also to have access to a vestibular therapist who knows about your diagnosis. And I think it's sort of like all doctors are doctors, and then there's like neurologists, and then it's within neurologists there's headache specialists. Like all PTs are, we all graduate as generalists, which is a little bit different than med school, but within physical therapists, a lot of us do specialize. Some people only see pediatrics. Some people only see people inpatient with like acute strokes. Some people see people in the ER. And then of people, see only people who are dizzy, but then within that, only really people with prolonged and sustained dizziness that's kind of is chronic, and whether or not has acute attacks also. So knowing like about chronic dizziness is not something that all PTs know. So if you're going to a PT, they might have you walking down the hall shaking your head, and it might make you worse. And that's something to be aware of and advocate for yourself for.
Yeah, and I think that like when I remember back when I first was diagnosed with vestibular migraine and I knew absolutely nothing, the person who I relied on most for information was my like vestibular therapist. And I still go back to, I mean, and this is back in 2015 or 2016, I still go back to that training on a daily basis. And the things that she taught me then are things that I still use today. And I think that people don't realize how long lasting that therapy can be. And even if you're not successful during the initial training, because sometimes I wasn't successful, but the education stays, and that's
absolutely.
what
I think
is so
that
great
the
about it.
educational portion of vestibular rehab can be more important than the like shaking your head, walking in weird positions, like the bizarre things I have people do on bouncy balls and mats and obstacle courses and things. And I think that the educational part of like stare at one thing, find a fixated spot, versus like I get really dizzy and uncomfortable in wide spaces. Why is that? And it's like a lot of times it's because there's not something to focus on. So if you can find a tree in the distance to anchor yourself to educationally, I think that can be a really helpful thing. And I'm not licensed in all 50 states to practice. That would be a lot. But we are in 8 states. And then within that, we can do like coaching and things like that and consultations for educational based treatment in any state, because then I won't give you medical advice. So if you live somewhere like I saw someone say Florida, I can't see you one-on-one from a vestibular rehab perspective, but I can see anyone from like a coaching, like educational, this is what's going on in your brain kind of appointment. Yeah.
Yeah. And then I saw someone asking if Neura treats vestibular migraine and then Meniere's. So we do treat vestibular migraine, but we don't treat Meniere's. That would need to be probably treated more by like an
Hmm.
ENT or a neurologist. But our medical director has vestibular migraine, and I have vestibular migraine. So it is something that we know quite well. And I think that there are a lot of like
Hmm.
practices that probably don't know vestibular migraine as well as like a doctor who actually
Yeah.
has it. So we're really lucky to have Dr. Burke who
Hmm.
can guide our medical team and knowing how to treat
It
the
is
condition because
different.
it is
Yeah,
different.
I think that's important.
Um, so do you want to walk through kind of how you kind of guide people through like a vestibular rehab
Yeah, absolutely.
therapy
So
session?
when you come to see me or anyone at my clinic where we have therapists in other states than what I'm licensed in as well, we're going to start you off with a bunch of paperwork, which if you need to take your time to get through it or need help getting through it, we will kind of help you through it depending on like how well you can use screens and things like that. And then from there, we go through lots of questions, but basically, I just want to know like what your history is with your vestibular disorder, what your dizziness feels like. That's a really important question to me. And then what parts of your life it's impactful for. I'm a very function forward therapist, and so is Dr. Jenna. And we find it's more important for you to be able to get up, make breakfast, go to the grocery store than it is for you to be able to shake your head back and forth really fast. Although that this tech is technically like probably the most known, most popular vestibular exercise, it's not the most effective unless you have vestibular neuritis and like that's it. It's probably not the most effective exercise for someone with chronic dizziness. So rather than that, we always focus on like what functional things matter to you. For some people, that's going to the mall. But I had a patient tell me a couple days ago, I can't go to the mall. And I started talking about like ways we can like think about this and XYZ. And she goes, I don't want to go to the mall. And I was like, oh, let's just like reformat what we're doing here because if you don't care about driving down Long Island and going to the mall, then like I don't care about you going to the mall either, rather than this patient over here who does. So very much function forward. And then I'm going to have you set some personal goals. I'll obviously put like goals that insurance companies like in case you want to submit your super bill to insurance. But I'm also going to ask you about your personal goals just for that kind of function forward measurement of what things that you would like to do. If we finish therapy and you have graduation day and we're all happy and stoked about it, like what does that look like for you? What things do you want to be able to say I can do these things because I went to rehab or because I did these other exercises first. And then I'm going to ask you like how much you think you can do every day, what things you want to do first, like is driving more important to you than cooking breakfast, like what is the most important thing for you. And then we'll kind of break down all of those different difficult tasks. For instance, driving, I'm not going to just be like, hey, go on the road for 1 minute. Like that's never going to be the first thing that we do. But we're going to either find like a virtual reality way to do it, a super controlled space in order to do a difficult task, and then kind of move from there. A physical therapist's job is to make sure that your life is easier and it's about you and that we are like a team in this. And so if my patients ever find that they're like, I didn't like this exercise or this wasn't helpful or this is making me worse and I need it adjusted. Like I want to know, and I don't want to know at our next appointment. I want to know like the second you can message me and feel comfortable on a screen to message me. They have 24/7 access to my email. I email them back first always. It goes patients, then clients, then everyone else. So it's a really important thing for you and your therapist, whether it's me or someone else, to have that kind of teamwork sort of relationship. Because I see a lot of comments all over the internet. It's like, I hate physical therapy, I hate VRT, I hate my therapist. And it's like, it shouldn't be that way. If you don't get along with your therapist, you're allowed to fire them. But also, it shouldn't be like you feel uncomfortable saying what's wrong in your body. It's your body. You get to say, I don't like this, this isn't comfortable, this isn't XYZ, and I need to adjust my plan of care based on that.
Yeah, I've always felt like physical therapy is, I love it because they're like, here, try to lift this 2 pound
Yes.
weight. Good job. And I feel like I've done so much. Or walk down the hall and I'm like, I did it. They're like,
We're
good
like,
job.
thank should. Yeah,
And
we are
that's
like
how it should
the
be.
most stoked cheerleaders. Like we are like the most excited high school cheerleader you can think of. Like, yeah, like literally that is me in all appointments. You can ask any of my patients. The patients are like, "Are you okay?" I'm like, "I'm so excited for you," no matter what that win looks like.
Yeah, because getting these like touch points back and being able to do something like go to the grocery store and shop at the grocery store without having a vertigo attack,
I
that is a huge milestone. And so it's absolutely
Absolutely.
worth
Anything
celebrating.
from I got up off the couch and walked to the kitchen and I wasn't dizzy or I didn't have extreme fear of imbalance or I didn't feel super imbalanced to I took 2 laps to the grocery store to I stood in line at Walmart. These are all things that like people have told me. They're like, it feels really small and lame, but like I did this thing this week and I'm like getting pom-poms out. Like I'm so excited for you because those things are the things like it's the weird little things that you don't think about that are frequently most lost when it comes to vestibular disorders and dizziness, and those are the things that I most want to help you get back.
Yeah, and I think that's something that we also really encourage at Neura is to set,
Mm-hmm.
actionable and reasonable goals so that you do get that
Yeah.
like dopamine hit and that you have that sense of accomplishment because when you have migraine, you lose so much of your past life and you lose so much of your sense of self. So being able to set these goals that are like having this sense of accomplishment
Mm-hmm.
is really, really important. And I remember each week I would hit a different milestone, and even though it was tiny, whether it was walking my dog to the street corner or whatever it was,
Yeah,
I that was a goal, and I would hit that, and
absolutely.
that
And
was a
I
big
also
deal.
think it's important to kind of take a step back and let yourself shrink down your activity a little bit while you're going through rehab. And I was talking to a patient about this yesterday and probably also the week before that. Like I talked to everyone about this, that when you are doing something and it makes you dizzy, and so you just keep doing it to that intensity over and over and over again and expect that it gets better, it usually doesn't. And I think that dizziness, well, I know that dizziness is
Mhm.
such a bizarre, abstract feeling. Like it just has to get better. But if you think about it, you can make an analogy to something more concrete. So I always talk about the hamstring tear. And if you tear your hamstring training for a marathon, and then you don't go to rehab and shrink down the amount you can run or stop running entirely while you rehab that injury, it's either going to keep re-tearing or it's never going to repair itself. And so a lot of people are like, well, I have this issue, but I used to be able to do insert activity here, so I'm just going to keep trying it. But your brain is so overstimulated a lot of the time and can't tolerate that much because your threshold just isn't probably as high as it used to be. And we're working on raising that threshold and getting it to a place where you can be up here, you can be more comfortable doing insert activity. Like, I don't care what it is, I will find a way for you to do it. But I think that back to the hamstring, like if you keep running a marathon every day and you're like doing your couch to marathon and you start with that 25 miles, you're gonna tear a hamstring or do something, right? And then if you keep running 25 miles, it's not going to get better and you can't expect that thing to get better. So shrinking down the things that you do and saying, okay, I'm going to take a step back for a second and really intentionally rehab this portion of something, then all of a sudden your life kind of gets bigger again, if that those words aren't the best words, but make sense.
Mhm. Yeah, no, it makes total sense. And I think that that's something that a lot of people with migraine have a difficult time understanding and accepting. And it was something I absolutely had difficulty accepting because my
Yeah.
life used to be so big and I used to do so many things. And then I had to
Mm-hmm.
stop doing all of the things. But the only way I could get better was to stop doing all of the things and then to
Mm-hmm.
gradually build up and work my way up again so that my brain could handle all of the stimuli around me. I wasn't able to ride the subway for like 2 years, but you know what? I can ride the subway now. No problem. And I can ride the subway during a vestibular migraine attack, and I can handle all of it. So it's really what like going through that training and learning how to tolerate stimuli in a different way. Like I still get dizzy, but now I instinctively know what to do. And I think with that comes a lot of empowerment. And it's about getting to that place, which it takes
Absolutely,
time
it
to
does
get
take
to.
time. And I think that allowing yourself that time is a really hard thing to do, because a lot of the time, I've used to use the word time like 8 times, but a lot of the time you're like, but I just want to wake up and not be dizzy. I just want to go to the store and not be dizzy. And I'm like, yeah, I hear you. 100% I'm with you. Until we get to that, I will be here for you the whole time. But until then, you do need to take a step back and ask for help in these parts of life. Get your groceries delivered, or ask someone to drive you there, or ask someone to go for you, or what have you, in order to kind of get to a place where it is more comfortable.
Hmm. And there's absolutely nothing wrong with taking
Of
shortcuts and getting things delivered. I get I get my groceries delivered. I get my
Yeah.
pets food delivered. There's nothing wrong with that because what people forget when you have migraine is you are living with so many more symptoms than what
Mhm.
an average person is living with. Migraine is a full body disease, and especially when you have vestibular migraine, you have this additional layer of disability. And even though society doesn't recognize that migraine is the second leading
It
cause of
is.
disability, it is. And so expecting yourself to function at the same level as people who are able-bodied is
Hmm.
being unfair to yourself. So it's okay to take these shortcuts and to get your groceries delivered. It's not a personal failure. It
I
just means
agree.
that you're
And
working smarter.
remember that there are tons of people in this world that get their groceries delivered. And you don't need to hate yourself because you get
And
your groceries delivered. Like, there are
yeah,
150,000 reasons to get them delivered, from I don't want to go to the grocery store to I physically can't be there, and everything in between. And there's no failure in that. It's like, hell yeah, I can get my groceries delivered. Like, how convenient.
yeah, yeah. Most of my friends get their groceries delivered and they are not living with migraine.
Exactly. Exactly.
So there's no failing in having these shortcuts. And it took me a really long time to accept that because I was like, I can't do the things I
Hmm.
was able to do 6 months ago. There must be something morally wrong with me. And there's nothing wrong with
Yeah.
you. It's a dysfunction of the nervous
100%.
system. And getting to that point of
Yeah.
acceptance
And I
leads to a
also
lot of
think that,
freedom.
like, a tiny bit of acceptance at a time is also okay. You don't have to just wake up tomorrow and be like, I'm fine with this. Like, that's
Yeah.
probably not going to happen. But, like, 1 minute or 5 minutes or
It's
15 minutes a day of, like, I'm just going to sit with this and be okay with this for 35 seconds is better than I have failed at my entire life because of this. And it's hard.
yeah. And I found that it took a lot of me having to like
Hmm.
vocalize it and be like, this is
Yeah,
okay. I would just like sit in my apartment by myself. This is okay. Sitting by myself and like not
absolutely.
doing anything is okay. Um, and kind of remembering the things that my vestibular therapist would tell me and doing those kind of exercises and not the head bobbing, but more like tandem walks or focusing my eyes on different objects and things. I really
Hmm.
watched the optokinetic video a lot. Like those were the sorts of things that gave me a lot of help. And I think the big thing, as you said, that gave me the most freedom was to learn how to focus on
Yeah.
an object when I was somewhere. And that's when I really
Hmm.
like
That's
life
great.
cracked open again, and I could start to do things. It
It
wasn't so
almost
much the
never
head
is.
bobbing, yeah, as it was. Okay,
Yeah.
this is what I need to focus on,
Uh-huh.
and so I'm just going to focus on that,
Yeah.
and then I'm
And
going to
I
get to where
find
I
that
need to
that's
go.
actually, A, it's more functional, obviously, which is my favorite thing, but it also creates a capacity to go into different, scarier environments. And then that in itself is rehab.
Hmm.
So, like, you're doing one little
Hmm.
trick, which is a hard trick. Finding something to focus on and doing it is hard. But then once you can do that and you can do it consistently, you're like, oh, now I can go here and now I can go there and I can do this and I can do that. And that in itself like opens up your world so much and becomes super rehabilitative in a lot of ways.
Yeah. What's your favorite thing to
Oh,
focus on when you're like
I
walking down
think
the
stop
street?
signs. They're big and they're red. Yeah, what are your favorite?
Stop sign? Okay. To be honest,
I
it's usually like a piece
love
of
that.
gum on the sidewalk. Because if I look up too high, it makes me dizzy. So if I
Mm-hmm.
go to a stop sign, like I
Mm-hmm.
usually will do a stop sign if I'm going through a crosswalk. But if it's anywhere else, I'm like, okay, where's
Totally
the gum?
fair. Totally fair. I think that the stop sign when it's far, because technically for walking
Oh yeah,
posture, I'm not having
yeah.
people do this, that would be a lot. But for walking posture, you should be looking 10 feet ahead at all times. And if you look down at your feet, you're actually more likely to
Hmm.
fall. So if that piece of gum is in the distance, I love it. I'm a huge fan. And they're like, you live in New York, so
Yeah,
there's like a
yeah,
lot of
yeah.
pieces
That's
of
what I
gum
do.
I'm sure you can find.
There's a lot of gum
Exactly, exactly.
everywhere.
So I think that's great. But I do want to, if you're watching this, you're like, I'm a person who looks down at my feet a lot. That is something to tell your therapist because that is actually more likely to make you topple forwards. Hmm.
Yeah,
We're
yeah.
going
No, I'm
far.
talking like far in distance and walking like 10, 15 feet to the gum,
I
then
love it.
looking
I
and
think that's
finding
the
another
perfect
object.
tactic.
Um,
Trash cans are a good one too.
yeah, it's either gum or
Fair
trash.
enough. Trash cans are good.
Classic New
Exactly.
York.
Exactly. I had a lot more of that when I lived in New York than I do now.
Yeah. But those are the things that I think a lot of people don't realize
Hmm.
can give you freedom. And in the beginning, vestibular migraine, it in some ways, because I have multiple kinds of migraine, that one felt the most debilitating on my life because I felt like I had this almost like a
Hmm.
shroud over me, and I couldn't do so many of the things that I want to do. And even though now I have mums and it's so symptomatic, I can
Hmm.
do a lot more because it's like I'll just drag
Yeah.
the functional side of my body along. But when I was first learning to live with vestibular migraine, it's like
Yeah.
you're spinning and you are on a tilt-a-whirl, and it's how do you make that spinning stop? And so that's a really difficult thing to do, and it's a
Absolutely.
really
I
scary
think
thing to
that
do.
most of my patients with VM say, like, I had a painful migraine before, a different form of migraine before, and then something happened, now I have VM. I think that's a really common story. And most of them tell me, like, I could deal with the head pain. I can deal with the light sensitivity, sound sensitivity. Like, those are things I've learned to live with since I was younger. But the dizziness and the vertigo and like the fatigue that comes with a vestibular disorder, especially, is the most debilitating part for me. And so I if you are a person who thinks they might have vestibular migraine and you're really not sure yet, I really recommend seeing like a bunch of people because most people, if you're like going to your GP or your general provider and you're like, I'm dizzy, they're automatically going to send you to PT. Because for most common causes of dizziness, like BPPV and vestibular neuritis, acute things, that's really a very effective prescription to go to PT. Very effective. But if you're like, I've had recurring bouts of dizziness, it's kind of coming and going, it's getting worse, I'm getting really light and sound sensitive, now I have like these weird quick spins and like all these other things combined with it, that's when you're like, okay, I probably need to go to PT, but it might not be my first step. I have very kindly kicked a lot of people out of PT because for a lot of people, it makes them worse if they're not getting other treatment as well. So I always say, you should try and have your like the migraine itself, the migraine disorder, more under control when you start VRT, with the exception of I have tried absolutely everything. It's been 25 years. I've been dealing with this forever. And like I don't really respond well to supplements or medications or whatever. And I just need to try something else. And from there, we typically work on like different lifestyle factors that maybe their doctor hasn't given them as options yet. But I still don't do this first ever.
Yeah,
I have given plenty of VM patients
yeah,
that exercise, but never first.
yeah. And it's really hard, and I think that was one of the
Hmm.
first things I was told to do, and it was so hard, and I would have to recover for like
Yeah.
an entire afternoon after therapy. And the second time, because I did vestibular rehab twice, the second time I did it was much more about lifestyle and focusing,
Good.
and I got so much more out of it because it wasn't so much about nodding my head and everything. It was how can I learn how to exist in different spaces and
Hmm.
make those spaces
Absolutely.
work for me.
Absolutely. I love that. You're a good therapist.
So yeah. So I'm just wondering if people in the audience, if they have any questions about kind of vestibular rehab therapy or vestibular migraine itself. Again, we are with Dr. Madison Oak, who is a vestibular rehab therapist, and with Neurahealth, I am the head of social, and I have vestibular migraine. That's the topic of the day, and we are really excited about our new partnership. So if you have any questions, just pop them in and we will answer them. But so what are some of your other favorite tips for living well
So
busy?
we talked about focusing on something afar. Another one of my
Mhm.
favorites is not being afraid to carry around a device that might assist you. So something like trekking poles could be really helpful. That's also a good one.
Uh,
Something like essential oils where you're like, that's what that was, right? Like peppermint you're smelling for nausea, things like
yeah,
that. Yep,
peppermint oil.
exactly. And so I think that those are really great too. But I think with the assistive device, it can be a really helpful thing at first. And I'm not saying you have to go to CVS and buy yourself a gray cane. It's not what I'm saying. But I think that there are a lot of good options, like the small ones to fold up. And then people who have difficulty with standing kind of in the middle and having a conversation, that's a really common one I get, is just stand next to something. Stand near the wall, stand near the couch. If someone starts talking to you, be like, oh, let's go over here out of the way. And just like put one hand on the wall or lean on the wall. And that can be an incredibly helpful way of expanding the amount of time you can spend somewhere. And then if you're out to dinner, try to sit somewhere in the corner and then sit at the head of the table. That way you're not moving your head around so much when you're trying to talk to people. And then don't be afraid.
That's
Thanks. That's one of my
a good one.
faves. And then don't be afraid to excuse yourself to the bathroom either, because that is something where people are like, I
Okay.
can't excuse myself 6 times. Just go. No one cares. No one's thinking about you as much as you're thinking
Yeah.
about you.
Yeah. Yeah, that makes sense. Okay, so Tracy wanted to know if we are helping people in Florida. So
Mm-hmm.
I can answer for Neura, and then I'll let you answer. So Neura does accept patients from Florida. So if you have vestibular migraine, our headache specialists are able to help you. And then do you want to go in how
Yes.
you're able to
So
help
if
people in Florida?
you are living in Florida, I cannot see you for VRT just because of the way licensing works. But if you live in Florida, you can join my group program and I can give one-on-one coaching to you as a part of Vestibular Group Fit. Vestibular Group Fit, I don't think I've mentioned, but it's my subscription group-based program that's only $55 a month that will go over everything from sleep to hormones to exercise, different movement classes and things like that to help you with any vestibular disorder, but especially vestibular migraine. And if you're in there, then I can help you with one-on-one coaching as well. Yeah.
Okay, great. That sounds awesome. Someone else wanted to know about supplements. I don't know if you have specific supplements. The ones that we really
Mm-hmm.
recommend is magnesium. That's the big one for migraine, because people with migraine are deficient in magnesium. So that's
Yeah.
the one you really want to think about. But I don't know if there's anything specific for
Magnesium.
vestibular migraine. I feel like I took a lot of supplements, and it really just
Yeah.
gives you more expensive pee. Um, so
Yep.
magnesium's the big one.
Magnesium's a big one.
Um,
I know some people like CoQ10 and riboflavin, but not everyone likes
yeah,
them. Some people are like, it gives you weird side effects. That will definitely give you expensive pee because it makes your pee like neon orange. It doesn't always help, but magnesium is, I think, the first one that I usually go through.
yeah,
Yeah.
that's the best one, and that's what I use. And then so Shirley wanted to know the difference between vestibular
This is my
migraine
favorite
and
question.
vertigo. Um,
Vertigo is
yeah,
not a
go for it.
diagnosis. It is only a symptom. So if you have a prescription for vertigo, which it technically has an ICD-10 code, which means it is a diagnosis, but it's not. Like there's no diagnosis of vertigo that actually makes sense. But if you have VM, you could have vertigo as a symptom. You could also have vertigo as a symptom from a lot of other vestibular diagnoses. But if you look at the diagnostic criteria for vestibular migraine and you fit those, then you might have VM, knowing you also can have more than one vestibular disorder at a time.
Okay, that is a perfect answer. And for people who don't know what vertigo is like, I always say, if you remember what it's like to be on the carnival tilt-a-whirl and then getting off of
That
it,
is
and then that is
exactly,
exactly
that
what vertigo
is almost better than the definition.
is. So Jackson wanted to know, is vestibular migraine one cause of floating, spinning, and
It's
tilting?
one cause. It's definitely a cause.
Yes.
Yes, absolutely.
Yeah.
You can speak to that. Your tilt-a-whirl is definitely.
Yes. Yeah, I like to think of when I have a vestibular migraine
Mhm.
attack, it feels like my head is a balloon that is just like floating a few inches above the rest of my body. And then everything
Yeah.
kind of is going like this. So I have this like floating sensation, and then I will have sensations of spinning and vertigo.
Mhm.
And then my body does tilt as I'm trying to tell up from down. But if you want to go into other disorders that can cause those symptoms, I think people
Yeah,
would
so
appreciate knowing that.
vestibular neuritis can cause this, which is a viral infection in your inner ear. It can affect any part of your inner ear. You can have this from Meniere's disease that will cause hours and hours of spinning typically. You can have Meniere's disease and vestibular migraine. You can have vestibular neuritis and vestibular migraine. Floating and kind of rocking, bobbing, and swaying can come from persistent postural perceptual dizziness, which is also really common with vestibular migraine. What other vestibular disorder? Oh, BPPV. I can list a lot. That benign paroxysmal positional vertigo that can cause spinning in different positions. So it's a really important thing to understand what your diagnosis is. And I know that there's also a lot of people who are like, I've been dealing with this for years, and no one can figure out what it is. No one can figure out what the diagnosis is. You can still do a lot of lifestyle changes that are pretty much across the board, this similar or the same, whether it's migraine, 3PD, Meniere's disease, whatever, and try to get that to come down a little bit. But if you do need a diagnosis and you're like, I think that I might have vestibular migraine, Neurahealth is always who I send people to these days. So,
Yeah.
yeah.
Well, thank you. So then the next question is quick changes in barometric pressure. Can that bring on vertigo? So with migraine, yeah, barometric change
Mhm.
can trigger a migraine attack. So if you have vestibular
Yeah.
migraine, it absolutely can
I agree. And
trigger a migraine attack.
whatever, okay, so barometric pressure changes one way up and one ways down. I don't remember which. One is more common for migraine and the other one is more common for Meniere's disease. It's on Vega's website.
Okay.
And so if you look into that and then you like track the pressure, that's something that can be helpful. And then I recommend Weather X earplugs. There's no research for them, but people say that they work. And you just put it in right before the pressure's about to change, or if like a storm is coming in or something like that. I have some patients who swear by them. So, yeah, I think we missed
Oh,
one about me.
good to know.
Yeah.
Good to know. So do people need to get vestibular testing like caloric,
Mm-hmm.
VEMP to be diagnosed with vestibular migraine?
Mm-mm. There are actually no tests for migraine. Some people, there's like a flare on your MRI for some people with really long-standing chronic migraine, but not even for everyone. There's no like test for VM. I did see a really fascinating study recently about pupillary nystagmus. So your pupils are kind of going like this. It's really common with people with vestibular migraine, but not even for everyone. So it is a subjective history of like, do you have XYZ, and kind of looking at it that way.
Yeah, and we just did a post, and it goes into the kind of the diagnostic process, and it actually goes into
Mm-hmm.
the white matter hypersensitivities with an MRI, and it discusses that migraine is a diagnosis of elimination. So all of the tests that are done are not to diagnose
Mm-hmm.
migraine, but to diagnose other conditions. And if all of those conditions are ruled out, then that
Mm-hmm.
confirms the migraine diagnosis because migraine
Mm-hmm.
symptoms are so similar to other
Absolutely. Everyone's like,
conditions.
I have the exact same symptoms as this person, and there's always like one small thing that's like you have Meniere's versus you have vestibular migraine versus you have neuritis or whatever it is.
Yeah.
Um,
Yeah.
and again, yeah, just like you're saying, those tests can identify those other disorders.
And typically, like if you do reach out to Neura and you're not sure what you have, and you're like, oh, do you? Because we don't treat Meniere's, but we can kind of give, if you speak with our live chat, we can give guidance on what kind of doctor, like you would need to see a neurologist. But we absolutely do treat vestibular
Mm-hmm.
migraine and headache disorders. So that's just something to keep in mind. But a neurotologist is usually who we would recommend to treat any other vestibular disorder,
Yeah,
because
and
they're
just
so
like headache
qualified in it.
specialists, there are probably even fewer neurotologists. And most just regular ENTs don't like to treat dizziness. And so if like my ENT doesn't know, it's probably because they probably only want to treat nose disorders or something like that. So I know a lot of ENTs who hate dizziness. So that's something to be aware of. And also having more than one doctor if you have VM and Meniere's disease to kind of, and they should talk to each other. I know it's hard to get your providers to talk to each other, but they should if you're dealing with two really severe things.
Yeah, and that's something when you're a neuro patient, we do provide you with patient notes that you can give to your doctor so that they can have that conversation. Because when you have comorbidities like vestibular migraine and Meniere's, you absolutely need to make sure that your medications are working in sync with one another and that you're getting the proper treatment so that you can get both of those disorders under better control. So Suzanne wants to know about telehealth and more hands-on care. And like if needing positional maneuvers done or working on balance for someone who's higher risk. So I think this is more of a question for you than it is
there's
for me.
actually excellent research to show that telehealth VRT is equally as effective as in-person VRT. Even for the Epley maneuver, I don't treat a lot of BPPV at all. I've probably done it 2 or 3 times over telehealth and it has been effective. But I always find that like if someone does need hands-on care for neck stuff or BPPV or whatever, I'll always find you a therapist in your area who can help with that specific thing, and then I'll keep working on your vestibular disorder. If you live in somewhere that you're like, I can't act, like upstate New York, in rural upstate New York, let's say, there's not always a lot of people there who can help you with this, but there might be a cervical therapist who can help. So that is something to know. And then also, I find that hands-on cervical stuff, not for everyone, but for a lot of people with vestibular migraine, makes them worse. And so I haven't seen a really huge difference in people's neck pain of who I would be able to touch when I worked in a physical clinic. And now I can't touch anyone because I work on telehealth. I don't see a big difference in their neck changes. So, and again, I always refer you if needed.
Yeah, and a lot of those neck problems that you have is coming from migraine itself. So you can, once you properly treat migraine, some of those the neck pain will start to improve. Or if you have a comorbidity like fibromyalgia and you start to better treat the fibromyalgia, some of those will improve. And then you can layer in physical therapy and vestibular rehab therapy to treat those conditions. And like with Madison, at Neura, what we do is we will find a physical therapy practitioner in your area to help with any care that you would need. Or if you're looking for Botox, we will find Botox clinic in your area, whether it's with a university hospital or something. So we make sure that you continue with all of your necessary treatments, but that we will manage your migraine care. So AM Jans was just diagnosed with vestibular migraine, wants to know where to start. So what I would say is, first thing, if you don't have a headache specialist, you probably would want to get a headache specialist. And as we've said, we have headache specialists who are trained in vestibular migraine. And what you want to do is you want to get on this preventive plan first. And you want to put together a plan with your headache specialist. And that plan could include things in the beginning because you want to give your medications time to do their job. A lot of people are like, oh, but I want to just treat things naturally. And we need to remember that migraine is a dysfunction of the nervous system. And so sometimes you need more than just supplements to treat your migraine disease. So you want to give those meds time to work. And then that's when you start looking into things like occupational therapy or vestibular rehab therapy, and you start to let those things into the fold. Yeah, we have about 5 minutes left, so we can take a few more questions. Over-the-counter meds helping with vestibular migraine, less than headache symptoms, but more dizziness and light sensitivity. So we recently made a guide about acutely treating vestibular migraine, but you might want to
Yeah,
speak to
so
that
some
as well.
over-the-counter things work great, but I also want people to be aware of medication overuse headache, because that can be something that's really, really common with taking a lot of aspirin or Advil kinds of medications, where you're taking them every day and that actually increases your headache frequency, and so then or attack frequency, I should say, and then you take more because you're getting more attacks. And the solution to that is a better acute and preventative, and then kind of cutting that out, either cold turkey or not cold turkey, depending on what your doctor says for you is most helpful.
Yeah.
So yeah, it can be helpful. I loved that post. I shared it in the Vestibular group that actually I posted it so everyone would see it, because I was like, this is so helpful. So definitely go and find that if you.
Yeah. Yeah, we actually made I forget what it's called within Instagram, but there's like this the area where you can put all of
Oh,
the
a
posts
guide.
together. And so now we have like an entire guide for vestibular migraine. So if you have vestibular migraine, you can go to Neura's page and find that guide. So Val PA wants to know if it's possible to get your balance back when you have vestibular migraine. And I just wanted to give this demonstration because I have vestibular migraine. And I'm going to show you that I'm going to do a tandem walk. And you can't really see my legs, but I'm doing a tandem
Yeah,
walk.
and fist pumping.
And I have my balance back.
Yes.
So, yes, it is possible to get your balance back. And even when you feel dizzy, because I am having some levels of dizziness today, you can learn to use your core and other things to kind of get your balance
Absolutely.
back
So
from a
your
physical
balance is
sense.
based on three systems. You have the way you see the world, your vision, your vestibular system, and the way your brain processes that, and then your proprioception, or how you feel the floor. And those three things should work like a system of checks and balances, similar to how the US government should work, is what I say. But just like that doesn't always work. So these things aren't always working together like they should. But then when you do rehab, and your therapist can determine, are you overly visually dependent? Are you relying enough on your vestibular system? Are you processing your vestibular information correctly? Because it does more than keep you upright. It tracks acceleration, deceleration, spatial awareness, so much other stuff. Is that working with the way you can like feel the floor in your joints? If yes, and all those things work together, you will be able to get your balance back. When you have an attack, I always say treatment is not about how does this never, ever, ever happen again. It's more of how do you have the tools and treatments that mitigates it, but then also you know what to do when you have an attack. Then in those cases, like if you have an attack, your balance might be off for the day, or I might have a few hours of like not feeling super upright, and I have tools for that. But it should generally be back.
Yeah, yeah. That is a great answer. Well, I want to thank everybody for joining us today for this incredible talk about vestibular rehab therapy and vestibular migraine. Again, if you're a Neurahealth member, you now can have access to Dr. Madison Oak's vestibular rehab therapy virtually at a discounted price. And then if you are a patient of hers, you can have access to Neurahealth at a discounted price. So we hope that this is a way to better improve your quality of life and just make vestibular migraine easier to live with. I think we can both agree that we genuinely care about improving people's lives with vestibular migraine. It's so hard. So we are
Absolutely. It's
here
my
for
favorite
you.
thing to talk about and my favorite thing to do, and it makes my life so happy to be able to do it. So thanks so much for having me here. Talk to you
All
later.
right.
Bye,
I'll
Kim.
talk to you
Thanks.
later. Bye.